what made you come to the decision to go ahead and lift it, except for the medically fragile tonight? What went into that?
Well, really, most of the orders that we have in place, we're actually extending them for a longer period of time so we can focus on that vulnerable population we have, like the medically fragile, those that are on long-term care facilities and nursing homes. We are lifting the general shelter in place for the rest of the population, really based on the science and the data and my discussions with Dr. Toomey on where we are as we move into the phase one period of the reopening of America and people are going back to work. And that's really the reason I made that decision.
And can you tell me, what does a business owner need to be doing right now? Anyone that is about to be reopening in these next few days, what's your guidance to them?
Well, I think the good thing is we have a lot of guidance. I mean, all the information that we sent out again today has been out there, but we've got one-pagers for, barbers and salons. We've got one-pagers for restaurants. We have, if you have a retail establishment. So we've got a lot of guidelines for people to follow. That information's out there. You can get it on the Department of Public Health's website, and we're glad to help people with that. The Department of Economic Development has been working with business owners through this whole time. I'm very pleased with those that have chosen to open. This is not a mandate. We're giving people the opportunity to open whenever they think the time is right. But for those that opened over the weekend, I was really pleased at how well they were following the guidelines and also how well their customers were embracing that. People were actually proud about that. I continue to thank Georgians. They did exactly what we asked them. They helped us flatten the curve. That gave us more time to build our hospital bed capacity to be prepared for whatever's coming. We've passed our peak day, in some models twice already. Now they're saying there may be another peak. I mean, these models are all over the place, but the thing is, we're ready to deal with it, whereas 6 weeks ago, we were still building out hospital bed capacity, and we got a lot more rooms. We had the lowest total of ventilators being used today that we've had in many, many days, so the numbers are trending in the right direction. That's why we need people, even though we're lifting the general shelter in place, we need people to continue to follow what is in the order, and that is strict social distancing, no large gatherings, so those things are still in place. We're asking people to stay at home if you don't have to go out, but you certainly can, and when you do, you just need to be smart about wearing a mask if you're going to a public place. If you're in a park or going to walk on a beach and you can social distance, you don't need to wear a mask. But, Dr. Toomey was telling me if I'm going to get my hair cut or the grocery store or the pharmacy, I'm going to wear a mask. If I'm taking my dogs out for a walk in my neighborhood park where I can social distance, I don't feel like I need to. So people just have to be smart. Our citizens have learned a lot through all of this, and I'm really appreciative of their help.
Governor, will your order leave any autonomy for local mayors? Of course, Mayor Bottoms here in Atlanta wants people to stay at home. What autonomy will mayors have under this new order?
Well, the order will be the same as the other ones. They can't do anything more or anything less. The good thing, I think, for them is what I've been telling the local elected officials. We have given enforcement powers to the local governments. So if they have businesses that are not complying, if they have citizens that are not complying, they have enforcement powers. They can go out and start issue warnings. They can issue tickets. And for businesses that don't comply, after a warning and 2 tickets, they could actually have that business shut down.
That means local police can as well?
Correct. Yeah, local police, sheriffs, certainly all the state law enforcement will continue to enforce as we have. I will say most people have been following the guidance. The ones that haven't, we have been using the verbal warning as an education tool to let people know they're not complying, educating them on what they need to do, and really everybody's been saying, "Oh, I didn't realize that. We'll start doing that," and they're making provisions to be able to do that.
Okay, one last question, Governor. Talked to an epidemiologist yesterday. He talked about Rhode Island being one of the leaders in walk-in testing. I know you launched the mobile testing van, but there are still concerns that people who couldn't get to that van and also don't have a car for drive-in testing still won't be able to access testing in communities that are underserved. Talk about any consideration for setting up walk-in testing sites in minority and low-income communities?
Well, we've been talking to the community outreach group about getting to those vulnerable type populations and going to different places where we need to be doing more testing. I know we're working with the city of Atlanta right now. I think we tweeted earlier today that Fulton County had a mobile site they had up today that had 50 people waiting in line. We've been going with our mobile sites to specific businesses, long-term care facilities. We're glad to go out into the local community and do that. I would encourage people to contact your local public health director in the county. If you want us to set up a testing site where people could walk up or drive up, we're glad to do those kind of things. All those things are what we have in discussions now. I know on Friday we've identified a site for our mobile team to go that came directly from the community outreach committee.
And one last question about the CBS News report that just came out from the CDC that 80% of the Georgia population in hospitals are African American. Any thoughts to those stark numbers right now?
I haven't seen that report, but we know that has been the case, from that African Americans and a lot of our minority populations have been affected in an adverse way, really exponentially numbers-wise than the rest of the population. That's why we're continuing to focus. It's why I created the outreach committee of the coronavirus task force, and it's why, yesterday we had General John King working up in Gainesville, Georgia. He's fluent in Spanish. We're continuing to look and work with leaders that have a large African American population so we can continue to do the same. We want people to get tested, and some of the nursing homes that we're going to are in those communities to make sure that those residents are protected, and we look forward to working with everyone to do that.
Thank you. Can you just tell me anything else that you think may be a misconception out there or that you want to clarify today? I know some people were confused about the June 12th. That's just for pretty much a funding mechanism, right?
Well, really, all the orders go to June the 12th, except for what's happening on our restaurant, our businesses. All the business orders go through May the 13th. That gives us a couple of more weeks to really look at the data and decide what is the next step and whether it will be time for that. Everything else we went ahead and extended on out till June the 12th. The public health emergency, the shelter in place for the medically fragile and the elderly, the nursing home guidelines, all that is now lined up on June the 12th. But for businesses, I wouldn't even get into worrying about all that and being confused. Just know that the guidelines that we had yesterday are going to be the guidelines that we have today, and they're going to be the guidelines tomorrow all the way through May the 13th. And then over the next, really probably after about a week, 7 to 10 days, we'll start looking at where we need to go next, if anywhere, whether we need to extend what we have or whether we need to, loosen up some of those guidelines or perhaps do something else depending on what the data tells us.
Thank you so much, Governor.